rise to CFU-GM and then CFU-M. Okay, from CFU-M, your colony forming unit megakaryocytes. So megakaryocytes differentiate further into platelets. Okay, so then your CFU-GM or granulocyte monocyte, these are the ones that differentiate further into neutrophils, eosinophils, the granulocytes. You learn this in histo again. May kamasig, sige hubya man ni ma'am, sige man lang refer to histo, refer to ano. Panang review. So I think you already had this because I talked to Doc Casimero is also with me in micro. So I asked him, where are you now? Ano na topic? What are you discussing in ano? So tapos na yan. I know you're done with the cells in the blood cells. And then from the pluripotent hematopoietic stem cell, it also gives rise to the lymphoblast. Okay, so the lymphoblast differentiate further into your lymphocytes, and then your lymphocytes, there are two forms, into the T lymphocytes and to the B lymphocytes. Okay, so this one, the last group, this group are very important in the next two chapters of 30, 32, 34, when we discuss about the immune system. So these are the cells involved in the specific defense of the body. Okay. So Genesis, so this is a continuation of the previous slide. So for a cell from the pluripotent to differentiate into the different blast form of like CFU blast, CFU erythrocyte, or to the lymphoblast stem cells, you need all these factors. You have growth inducer. Example of a growth inducers are the interleukin-3, which will promote growth and reproduction of all the different types of a committed stem cell. Then differentiation inducer, because one type of committed stem cell to differentiate one or more steps towards a mature blood cell. So like before this one becomes a neutrophils or a basophils, okay, you need the differentiation inducer. And then you need the growth inducer for the CFUS to become CFU-GM or CFU-M or CFU-B, etc. Okay. So since the chapter is on RBC, so genesis of the RBC. So how did the RBC came about? Okay, so it started as a pro-erythroblast. So we'll go back to the last slide. This one. So this is the erythrocyte. So from the pluripotent hematopoietic stem cell, it differentiates into CFUS, colony forming unit cells, into a colony forming unit blast, into an erythroblast forming unit erythrocytes or the erythroblast to become mature erythrocytes. So the next slide is, okay, so the pro-erythroblast, it is the first cell identified as belonging to the RBC series. Okay, this is the pro-erythroblast. So, and then it differentiates further into a basophilic erythroblast, then into a prochromatophilic erythroblast, then into an orthochromatic erythroblast, and finally into an reticulocyte. Okay, so the basophilic erythroblast stains basic dyes, that's why it's called basophilic erythroblast, has very little hemoglobin. Then it differentiates further, and then it becomes filled with 30% hemoglobin. And then what happens? The nucleus condenses. So if you look at this, the pro-erythroblast, it has a big nucleus, and then as it differentiates further, the nucleus gets smaller, and then ultimately nawala. Okay, so it condenses, and it is being absorbed, and then the endoplasmic reticulum in the cell is reabsorbed, and then it is now called a reticulocyte. So you look at this right here, nuclear structure, and then So the reticulocyte, these are small, and then a small basophilic material, which is a remnant of the Golgi apparatus, is what is left there. And then it gets out of the bone marrow and goes into the blood, into the circulation. So this one, the other stages will take place in the bone marrow. Then once it becomes a reticulocyte, by a process known as diapedesis, it gets out of the bone marrow, it goes into circulation, and in a few days, in 1 to 2 days, it becomes a mature erythrocyte. So this is a mature erythrocyte. So it is, if you look at the erythrocyte, it is non-nucleated, okay? So the basic material in the reticulocyte disappears, and in 1 to 2 days upon entry into the blood, this reticulocyte now becomes a mature erythrocyte. So regulation of red blood cell production, so the role of erythropoietin. Okay, erythropoietin is a hormone. It's a hormone that stimulates production of RBC, and its production is increased in response to hypoxia. Siguro I need to have this eyeglasses ko. Pa-change ko. Buwan nada. Saka minulay cellphone. Yung anak na harap na. Okay. And the most essential regulator of RBC production is tissue oxygenation. So in a hypoxic condition, the bone marrow is stimulated to produce RBC, di ba? Because the RBC are the one that has the hemoglobin, and the hemoglobin transport the oxygen. So if you have few RBC, few hemoglobin, then fewer oxygen transport. So it will lead to tissue hypoxia. Okay. So, so where does this erythropoietin originate or came from? So this is from the kidney. So the erythropoietin is produced by the kidney. It's a hormone from the kidney. And then it will signal or send, once there is, you say, oxygenation of a particular organ or structure is down or low, it will signal your hematopoietic stem cell to produce more. So yun, the same steps. So from pro-erythroblast until it becomes erythric, and then erythric becomes a mature RBC, in order to supply the correct amount of oxygen needed by a tissue for oxygenation. So when oxygenation decreases, yun, parang cycle, it stimulates kidney to produce erythropoietin. Erythropoietin will signal your bone marrow to produce more RBC. Okay. So what are the conditions that decreases? These are some of the conditions that will decrease oxygenation of our tissues. Example, low blood volume. So chronic anemia also. And then low hemoglobin. Ito may anemia, the hemoglobin is low. If you have low blood volume, low hemoglobin, or poor blood flow, and those persons with pulmonary diseases, okay? Because oxygenation of the blood is in the lungs. Okay? So these are some of the factors that will decrease tissue oxygenation. So if you have this condition, this can cause decreased tissue oxygenation. And so this one will stimulate erythropoietin production by the kidney signaling the bone marrow to produce more RBC. So, ganun lang. Okay. So maturation of RBC, what is required? What are the requirements? So you need vitamin B12 and folic acid. These are important for maturation of RBC. And both are essential for synthesis of DNA. Any question? And vitamin B12 absorption needs the intrinsic factor. And where do you find the intrinsic factor? They are found in the gastric parietal cells. Okay, if you notice, those of you who are already married or became pregnant or what, when you go for prenatal checkup or yung mga nurses dyan, if you went on duty, especially those who have experience working as ano itong nurse program sa DOH, you are assigned in the RHUs. When they give prenatal checkup, they give iron with folic acid. Okay, because folic acid is important for maturation of RBC, and then for your B12 to be absorbed, you need the intrinsic factor. Okay. So absorption of B12 requires this intrinsic factor. So your intrinsic factor binds tightly with B12, and then your bound B12 is protected from digestion by your GIT secretion. Why is B12 important? Because it's important for final maturation of the RBC. Then still in the bound state, the intrinsic factor binds to receptor sites on the brush border of membranes of the cells in your ileum. The ileum is a part of the small intestine. Then the B12 is transported into the blood in a few hours by a process known as phagocytosis, carrying the intrinsic factor plus vitamin through the membrane of your intestine. So this is the formation of hemoglobin. Again, na-discuss in biochemistry, but just a review of what you learn in biochemistry. How is a hemoglobin formed? So this one is the structure of a hemoglobin molecule, showing one of the 4 heme chain that bind together to form a hemoglobin molecule. So the initial step is 2-succinyl-CoA plus 2 units of glycine. You form a pyrrole, this one, we call this a pyrrole, okay? Then 4 of these joined together, they become protoporphyrin 9, okay? Then your protoporphyrin plus iron, ferrous, it becomes a heme. Then a heme with the polypeptide, it becomes hemoglobin chain alpha or beta. So 2 alpha and a 2 beta chain becomes hemoglobin A. So that's how hemoglobin is formed. So each of the 4 iron atoms can bind loosely with 1 molecule of oxygen, making a total of 4 molecules of oxygen or 8 oxygen atoms per hemoglobin molecule. Na-discuss ko na ini biochem. Okay. So oxygen does not combine with the 2 positive bonds of the iron in the hemoglobin. And then it binds loosely with 1 of the coordination bonds of the iron atom. So, and it's an extremely loose, easily reversible bond. And then furthermore, the oxygen does not become ionic oxygen, but is carried as molecular oxygen composed of 2 oxygen atoms. So that's the sign, the abbreviation O2. Okay. So distribution of iron. So total body iron is 4 to 5 grams. 65% is part of hemoglobin. And then 4% are myoglobin. Then 1% are heme compounds, which are made up of cytochromes, cytochrome oxidase, peroxidase, and catalases. Then 0.1% is bound to transferrin, and 15 to 30% are stored in the reticuloendothelial system and in the liver in the form of ferritin. So the storage form of iron is ferritin. So remember this word. So it becomes ferritin, storage form. So this is the scheme to show us the transport and the storage of iron. Okay. So let me see. Okay. So the lifespan of the RBC is about 120 days, diba? So after 120 days, what happens to the RBC? So it is being broken down. It goes into the spleen. We remember from undergrad, the spleen is the slaughterhouse of the RBC. So it goes into the spleen. It's being degraded when after breaking down the RBC, the hemoglobin. Sorry, uh, hemoglobin and other products are released from the old RBC. And some of these products are still useful, so they are being recycled. Okay, so you will have, so they are being phagocytosed by the macrophages in the spleen, so they are being destroyed, and then they release free iron. So what happens to the free iron? Some are stored as ferritin, so this is in the tissue, and then some become hemosiderin and heme. And then others becomes transferrin. 0.1% of that becomes transferrin and found in the plasma. Okay, so we excrete about 0.6 milligram daily of iron, and the absorption is in the small intestine, and then blood loss of about 0.7 milligram iron daily in the menses, if in females. Okay, so when an RBC is broken down, it releases bilirubin. So it goes into the liver. It forms parts of the color of our stool. And then and the others, they are released, the iron is released as free iron, and they goes into several pathways. So they can be stored, they can be part of in the production of a new hemoglobin. And then enzymes, or they can be in the plasma. So liver secretes apotransferrin in the bile. And then in the duodenum, apotransferrin binds with free iron and also with iron compounds such as hemoglobin and myoglobin from the meat. Then the transferrin form binds with receptors in the intestinal cells, the transferrin. And they are absorbed by penocytosis and later released into capillaries in the form of plasma transferrin. Then iron absorption is very slow, a few milligrams per day. And total body iron is controlled mainly by altering the rate of absorption. That's why in pregnant women, we ask them to be taking before delivery iron with folic, and then after they delivered, another 3 months of iron supplementation, because its absorption is slow, so that these pregnant women don't get anemic. Okay. So here, the lifespan is 120 days. Okay, so after 120 days, they become worn out, so a new one comes in. That's why it's advantageous to have during bloodletting, if you volunteer to give blood, if you're a healthy, more than 50 kilogram in weight, you have no underlying diseases, not taking any mga medications. Donating blood is good because it replaces the old blood, and then it will stimulate the bone marrow to produce and release newer RBC. And pag younger RBC, pero younger person, they are more active, more than the older ones. So that's why people, if you ask somebody who have donated blood, how do you feel after the blood donation, after blood extraction? So I feel light, I feel okay, because that's it. you have the old RBCs are being drawn out, and then the bone marrow starts producing a new one. Okay. And then you also, once you have the blood also are in the blood bank, they're stored, and then after, you cannot keep them for long because of the lifespan of the RBC. If you are transfusing an old blood from the blood bank, waray na ito kuan. Kumbaga, according to my granddaughter, waray na ito power. So they do not have a nucleus, mitochondria, or endoplasmic reticulum. So anuclear. Why nucleus? No mitochondria, no ER. Then they have cytoplasmic enzymes that are capable of metabolizing glucose. They form small amounts of ATP. They maintain pliability of membrane. They can maintain membrane ion transport. Keep iron in the hemoglobin in the ferrous form rather in the ferric form. And then it prevents oxidation of proteins in the RBC. So lifespan and destruction of RBC, 120 days. So it bursts and releases the hemoglobin. So hemoglobin is phagocytized by the macrophage, especially by the coffer cells in the liver and in the macrophages of your spleen and the bone marrow. The macrophages releases iron from the hemoglobin into blood carried by transferrin either to the bone marrow or to the liver or to the other tissues. That's the fate of an old RBC. Then the porphyrin portion of the hemoglobin is converted by the macrophage into a bilirubin, and it's released into the blood and later secreted through the liver into the bile. So it contributes to the color of the bile, and then also to the color of the stool. So that's all about RBC. So this we'll talk about some of the conditions. So anemia and polycythemia. So these are two opposite entities. Yes. Huray pa balik. Uy, haircut ka man ba? New haircut ka man. Kaya na, kung ngay para mas-shred liwat at iba. Kaya damo pa ba ya? Excuse damo pa dito. Oh, sige. Pwede mag-ano lang kita, magdala lang kita tag-usa ka badge. Kaya ito man siguro we can put that in the ito nga box na Nature Spring para dilat dito magkalat man kita kasinahan ni Abi.
Kaya mga nagsirin kung mamabilit na sa inaro.
Oo.
Para at least na kukuhan na muna.
Ano man?
Mura ko katikang kay ang tuwan na busy man na dito so wala yan ginkuhan ko na kan man.
Ito man yung box. Magbutang na kita, magdadala lang kita tag-us ka box. Dito mo, kaya may kita dito makapuno.
Ano lagi?
Makakuhan kita dito high blood.
Pinasing pa na naman dyan pagpala sa halik.
Oo. Sige.
Sige mo na ito, nakatipa ng hospital.
Okay, sige lang. Di
naman
matapos. Okay, sorry for the interruption. We're having some concerns here at the office of Micro. We're cleaning up. Okay, so these are two extreme conditions involving the RBC. So one is anemia. Kung anemia, you have a low hemoglobin count. Anemic. It's a common term. Maski layman, marami na anemic. Diba? Like you go to a pansiteria, naging na siya, naging kasabihan. Like, I remember one time, sabi ko, uy, anemic man ang pansit. Okay, kulang siguro ang soy sauce, mabusag. But I noticed nga, mga Tagalog sa Luzon, their pansit is anemic. Di rin na masyado para toyo. But I like my pansit with with toyo. So I don't like the anemic pancit unless it's palabok. Okay. Para pala ito, pawara gutom. And then polycythemia naman is the opposite condition when you have too much RBC. Diba? The normal count was in the male, mga 5 million, 5.2 plus minus 300. In the female, 4.5, yes. Sorry, excuse. Ito ba, dyan yung mga papel, isulod lang carton. Ito nga naka-black supot, ano na siya, what do you call that, ilalabog na. Pero dito nga ito din ang iniinihi niya, isi-shred ito. So, isusulod mo supot. O dadangat sa office, kaya naman ipinadarang nga shredder. Kasi kung mas pwede di mag-shred unta, kaya haluag, waray damong nga kuan. Di man pinapadara ko no. So dito, isulod, dadangat sa office. Sir ko kandali, ayaw lang pagdarin damo, kaya may kita dito makapuno, kasinahan kita dito ni Ramam. Ito niya, ilalabog na ito, John. Ini nga nag-black kuan namon dito. Ito hiya nga, waray, amo to for shredding. News ka, sa kabukid-bukid. Okay? Okay, so anemia. It's a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your tissues. Okay, so anemia can make you feel tired and weak. Kaya why do you feel tired and weak? Because kulang ng oxygen, tissue oxygenation. Because why? Kulang ang oxygenation ng tissue because if you're anemic, low imong hemoglobin. So hemoglobin is the one that carries the oxygen. So logical. Then there are many forms of anemia, no? And each with a cause. So diri lang tanan iron deficiency. Kita kang bata nga pale looking, iron deficiency oftentimes it's from a chronic blood loss, labi na kung damo wating nga hookworm. Okay? Because hookworm can cause anemia, a hypochromic microcytic type of anemia. Okay, so anemia can be temporary or it could be long term. And it can range from mild to severe. Okay, so this is a microscopic appearance of a normal amount of RBC in the field, and this one is anemic amount of RBC. So the medpic they know this. Looking at this blood smear, alam mo na. So anemia, it's a decrease in oxygen carrying capacity of the blood resulting from lower than normal number of RBC or abnormal or deficient hemoglobin content. While polycythemia is the opposite, excessive amount of or an abnormal increase in number of RBC, and it results from bone marrow cancers or a normal physiologic response to high altitude. So if you are from Nepal, was living in the high mountains of Nepal or Everest or Matito na Ukoy actually. People in those areas oftentimes or less polycythemic etc. It's a physiologic response to have living in the high altitude because of the lower oxygenation at that height. So the body has to produce more. So classification of anemia. So on the basis of the cause, so it could be a blood loss anemia or inadequate production of normal blood cells or an excessive destruction of blood cells. So blood loss, like you had an operation, surgical, the operation becomes so bloody, or like a soldier in a battle or na ambush, naigo, you were hit by a gunshot wound, hit, tapos far from a medical center na iha ka ma-rescue, naubusan ka dugo, blood loss. Then, or inadequate production of normal blood cells. So you have a certain condition wherein the body, a bone marrow condition wherein the bone marrow cannot produce blood cells. So yun, magkaka-anemia or excessive destruction. So there are also conditions that Ito ini basura ini. Atad to kadakwan pati ini nga usa. And then on the basis of morphology, anemia could be normocytic, could be microcytic, or macrocytic. So normocytic means the size of the red blood cell is normal. Okay, and then microcytic, the RBC are smaller than normal, and then macrocytic, and RBC are larger than the normal size. So here you should know what is the normal size, okay, before you can say it's macro or a microcytic. So blood loss anemia. So after a rapid hemorrhage, you can go into a blood loss, massive blood loss. Then it's a normocytic. Your RBC count decreases or drop, low RBC count. While in chronic blood loss, you will have a microcytic, a hypochromic type, as in the case of an iron deficiency anemia. Okay, classic example we give is yung anemia secondary to naubos dyan. Anemia secondary to you have parasitism, hookworm infestation, massive infestation, because the hookworm will feed on the blood and the intestine. So hinahinay ang nagsigisip-sip. So you will have a chronic blood loss, microcytic hypochromic type. While in the aplastic type of anemia, it results from aplasia, bone marrow aplasia. So you have a malfunctioning or lack of functioning bone marrow or an acellular bone marrow. So what are the causes of aplastic anemia? Exposure to gamma rays, radiation or excessive X-ray treatment, certain industrial chemicals, and certain drugs. So be careful, like you will come across medications like may cause aplastic anemia. But when you get to read mga adverse effects of certain medication, say, di nalakit matumar, kaya ba na kung magka-aplastic anemia, no? You have to weigh the benefits you will get from drinking that medication and from getting the aplastic, having an aplastic bone marrow. Anyway, it does not happen pag inumuhit ng medisina magkaka-aplastic na. Siguro prolonged use of that particular drug that has a detrimental effect on your bone marrow can, so do not self-medicate. Tell your patient, consult a doctor, consult a physician. Because there are certain antimicrobials that may cause aplastic anemia. So, i-evaluate nga pasyente, hindi na lang mainom yung medisina. Okay, like in the community, people are nowadays cases of diabetes rising up in the community. So the first line of anti-diabetic drug we gave is metformin. Then a lot will not take metformin, kaya nasing masisira daw ang liver nila. So what I used to explain to the patient, I said, by the time your liver is destroyed, namatay ka na sa diabetes from other complication of diabetes, so you better start taking metformin. It's not that if you take metformin for a month, yung liver nasira na yun. Natural, every medication, anything that we take in has, may effect yan sa liver because everything goes through the liver. Anyway, the dosages are so computed, regulated as to cause minimal. Kay ibang pasyente masinglik mainom kay I'm not going to take that because it's going to destroy my liver. Natural, everything that even the natural food that we're taking in, kinaungkat ng mga tosino, mga processed products. So they are not also pero yun, you weigh the benefit over the disadvantages. That's our role later on. Your role as we become physicians, clinicians, explain to the patient. Dila kay paabotit pasyente masing, di inom hedi, you take this 3 times a day for 3 months. and then you come back after 3 months. You need to be able to explain why. Para yung pasyente may compliance. No? Okay, so we're going out of topic na, pero this is just an insight. No? May pagreklamo nga, nagkawara-wara sila, boss. It's part. Salamat nga ni Kamo. Because I heard somebody said nga, there's some professor going out of, okay ito, wisdom of the old ito. Hindi niyo magbabasa hagayton. Okay. So another type of anemia is megaloblastic. It's due to maturation failure of your RBC. Mega, dagko, megastar, Sharon Cuneta. Due to maturation failure caused by poor absorption of B12 from the GIT. So why is it that you cannot absorb B12? Okay. And this type of anemia is called pernicious anemia. Okay. So what happens is there is a maturation failure of your RBC, and again, folic acid deficiency in the diet can also cause maturation failure. So what are the causes of B12 deficiency? So like gastric atrophy. So you will develop pernicious type, your patient. Or patient goes into gastrectomy. So tanggalan stomach or resection of a large portion of the stomach. And we know that the intrinsic factor needed for absorption of B12 is in the stomach. Okay? It's in the parietal cells of the stomach are the ones that produce the intrinsic factor. So kung gamay na lang nabilin imo stomach, so waray ka na intrinsic factor. So there is difficulty in absorbing B12. Or ileal resection, resection of the ileum, same, kay absorption is also in the ileum. Chronic inflammation of the ileum. So these are conditions that can cause pernicious type of anemia. Then dietary deficiency. And pathology of macrocytes. So failure to proliferate rapidly. So they have a larger than normal RBC. So this one is a normal RBC. And these are the big ones, the mega. So the mega karyocytes, look at them, they are paler in color. Mapuputi na. Nakaglota. Okay. So they're called megakaryocyte, and the anemia is megaloblastic. Okay. So treatment for dietary anemia, you give oral B12 plus folic acid. Then if you have a pernicious type, since absorption is difficult in this condition, so the B12 is given parenterally or injection by injectable B12. Okay. Then another type is hemolytic. So hemolytic, the RBC are fragile and they have a shortened lifespan. Example of hemolytic type of anemia is in a condition known as hereditary spherocytosis. So the red cells are very small and they are spherical. And then another condition is in sickle cell anemia. You look at the RBC, this one is sickle cell. So it's the RBC appeared like a cycle. So it contains the abnormal type of hemoglobin S, and it contains a faulty beta chain. So what happens is it precipitates into, instead of it being a rounded biconcave disc, it precipitates into long crystals. Inside the RBC, when the individual is exposed to, those with sickle cell, exposed to low oxygen pressure. And then another condition is erythroblastosis fetalis. An RBC positive fetus, an RH positive, sorry. An RH positive RBC in a baby or in a fetus attacked by the antibodies from an Rh negative mother. So what happens is you will have hemolytic or hemolysis of the red blood cell. Okay, we will just also discuss this in the last chapter. Okay, so cycle cell, abnormal hemoglobin, they have a spiky and sharp edge RBC. So these are the conditions that will trigger or stimulate the cycling. Anxiety, stress, vigorous exercise, low blood oxygen content. So it's a result from a change in just one of the amino acid in each of the beta chain of the globin molecule. Okay, then the opposite spectrum is polycythemia. So in polycythemia, you have more RBC than normal. So 6 to 7 million per cubic millimeter, that's much. Para kang nanalo ng loto, ka 7 million ka na instead of the 5 million RBC, 6 to 7 million ka. Then you have secondary polycythemia. It's due to a chronic hypoxic condition like people with congestive heart failure. CHF is congestive heart failure. Emphysema, and those persons are people living at high altitude. Then physiologic polycythemia is native to live at high altitude between 14,000 to 17,000 feet. Where the atmospheric pressure is very low, oxygen atmospheric pressure is low. So ito nga, those living in the highlands of Nepal, Tibet, mga bukid-bukid, Kathmandu, yun, they will have this. So there are two types, the polycythemia vera or erythemia. It's this condition is due to genetic aberration of hemocytoblastic cells that produce the blood cells. So the RBC count will reach up to 7 million per cubic millimeter, and they will have a very high hematocrit. What's the normal hematocrit? Can you remember the first slide? Jetro, Pidida? Are you around, Jetro?
Yes, Doc.
Any relation to Lorna, your mother? You're from Leyte?
Yes po.
Anak ka ni Lorna?
Yes po, Doc. Opo, Doc.
The mother was our student. So parang aputa na ikaw.
Opo, Lola.
Regards. Regards. Ingali lagi happy, ma'am. Isang lagas na.
Opo, Doc.
Okay, so ano to na question? Kalimot lang ako, Jetro. We're talking about hematocrit. Ano to normal hematocrit? What's the normal hematocrit count? Diba? Ito on first slide of the hematocrit is the percentage of cells that is of the blood that are cells, and it's about 40 to 45%. So when you hear hematocrit is 60% over na, polycythemic na ito, sobra-sobra na yung RBC. So if you have more RBC, natural, more hemoglobin, more and hataas ang hematocrit count, diba? So what happens when you have a lot of RBC? It will increase the viscosity of the blood. No? So the blood flow is hampered or becomes sluggish. And people with polycythemia, they have this characteristic ruddy complexion with a bluish tint of the skin. Parang cyanotic, parang nangangagom. Are we all Filipinos, or man foreigner, para bang lagom if you have experience cooking banana, boiling banana, nga di pagudluto banana, ginhaon mo, banahangog, amutot color, ruddy color. Basta, they have a parang dark bluish tint sa skin nila. Okay, ay, so tapos na pala. Okay, so that was the last slide. I didn't. Tomorrow we'll meet again for the next, and I think we'll discuss, ha? Ano? Buwas? Okay man. Okay, tomorrow, according to Misha, we will start at 9. Okay, di ba whole morning man ang physio pag Martes? Ano? Okay. So tomorrow we'll start at 9 because I would like to finish 2 chapters tomorrow, talking about the WBC and then the immune system. That's quite a long. That's the longest, longest topic discussion I have in this unit. Itong immune system, the WBC and the immune system, because we will be discussing the natural and then the artificial immunity. Blah blah blah. And then the third on Wednesday, blood typing and the blood clotting ba to? Ano to ang topic ko sa dito? Okay, so is there a reaction from the group? Ano ba ito papanangs ni Madam? Ni Madam Ani? Yun lang. Quiz. No. So any reaction? The quiz will be on January 6th. That's a Wednesday. So if you have concerns about the quiz, the class coordinator, you can contact Dr. Paloma about it. Because first she decided it on a Monday. 4. Saring ko 6 na lang, kaya 4 is the first day of classes. The student siguro may hangover from the holiday, etc. And then we have to set up naman po sa school. We have to come to school and then give the questions to Ma'am Shia, so we can download that to you, how to go about it. And then there's one thing also, if you think it's this online class is parang stressful to you, think of us, the faculty. It's more +5 stressful to us. Actually, I don't like this mode of, I like it face to face. Also, I can see your reaction, see how interested you are, see your enthusiasm. Because, and according to Dr. Paloma, we need to have the quiz because the first bi-monthly scores were not good. And I said, I don't know why, because the students are just at home. They have no other, no distraction. You just stay at home, read. And then you're not opening your laptop. You're not having lecture, like today. My lecture this afternoon siya, waray. So 1 to 2 hours in the morning, another 2 hours in the afternoon for biogymnasium. So that's not much. Kaya nga niyo magbinulay din at iyo laptop, tagpira ka oras, magdinuta, tagpira ka oras until the wee hours of the morning. So if it's hard for you, it's para ako, it's 5 times harder for me. I have even to risk coming to school because I do not know how to make all these connections at home. My Wi-Fi kabalay, pero dikit maaram. That was sometimes I ask my son, anak nga, doktor na, sisina ha, kay kadamo na ko nagtutdo, dik na habaro. I said, maybe I have that, I do not like to learn. Nasigod kinakapoy na kini. Pero wala kita magawa. We are here for you, so just bear with us and try to help yourself. So make good. And anyway, it's a semestral subject. So I've been telling my students in the second year, those who are taking up micro, I'm the one heading the department right now. It's not because do not think there's a pandemic that there will be mass promotion. It's not. If you don't make it to the cut-off score, I'm sorry. You have to study harder. Anyway, physio is a yearly subject. You still have 3 bi-monthly, second, third, fourth. But in micro, it's semestral. You only have first and second bi-monthly, so it's very hard for that second year. So for your case, that's why Dr. Paloma and I talked last night about this. So in order for us to be able to help you, you study. The coverage of that exam on January 6 will be my lecture, about 40 items from this, and then 10 items coming from Dr. Ryan. So that's the only way we can be of help to you. Okay? And try to not just memorizing things like parrot, understanding what you're reading. So if you read it, and as an advice, if you read it or listen it for the first time, you were able to absorb 20% of what we have this morning. You read it again, second time, another 20%. So my 40 ka na. So read it again the third time. So 60 ka na. At least nakakapute ka na. Yun, that's the secret. The faculty, as we have been through like that also. Naging estudyante din kami before we became your teacher, became professors. So we went through student life. It's much easier nowadays for you. Nung panahon namon, maski cellphone, waray nga ni kami. Maski telepono, waray. Cellphone pa kaya, laptop pa kaya, iPad pa kaya, waray. Even the books during our times were hard to get. In the first year, I didn't have a book in anatomy. I had books in physio, biochemistry. But anatomy, Gray's Anatomy, the thick one, was very hard to acquire. Maski may iparalit, it was very hard to get a copy of that. So, but it was not a problem. I came out excellent student in anatomy without the book because I read every night. My two housemates have a book. So when they were asleep, I wake up and open their books and read. And then, I read and then I write. So I copied everything from that book para akong secretary. So when you read and then you write, you retain more. So from experience ito. So yan na. Hindi naman also unwrite. Sige na lang ka mo read. You have that e-books. So, nakakurehan books. Okay. So there's no reason for you to, kasi makapasar kay, kahubya na la ito. Hindi rin na ito, hindi rin na, nung alaw, maski cellphone, telepono, waray. I went for the postgrad in Bangkok, Paskong Pasko. I was trying to call home, waray kami telepono, anam neighbor kay taga-bayan head and engineering, they have a telepono. Makuri nga ni pagsulod, I was not able to contact my family. Naku, kakuri naman lahi ni third world country. Pero yan na, so you all have the gadgets, the technology. Okay, ay nalaka mo ito. So because this is not normal times, kumbaga abnormal. If you are having problem, suffering from these abnormal times, labaw pa kami kay mga lagas na, senior na. So it's just all learn to adapt to our new normal. Okay? So is there, ba't coordinator rin siya? Miss Joanne, any concern from the group?
Nag-chat po ako kay Doc Annie. Nag-ask po kami kung anong specific topics po yung kay Doc Mambulaw sana, pero hindi pa po siya nag-reply.
Ay, okay. Maybe we will ask Miss Shia to contact Doc Mambulaw. Kaya sabi ni Doc Annie, may 2 chapters pa daw? 2 chapters or 2 lectures? Okay, the last 2 lectures of Doc Mambulaw. Yun ang niya. Kay I told her, man, kanang ako ra, it's easy. If ako lang, I can make 50 questions out of this. I can make 100 if buutan ak nga kuan nga staff. What my superior says, I do it. So bari nga Doc Annie ma 100, ay mo anta ka mo 100. So, yun. So, pag ano, I will try to ask Ma'am Shia if she can contact Doc Mambulaw so para makakontribute ng 10. That's why I schedule it on the 6th. Sabi ko, sabay ko na lang because I'm also giving periodic exam in para on the 6th. So, para usala pagkanhi eskwelahan. You know, I have to be in school para mag-lecture kay diri ko man makaya sa balay ng mga pag-connection, mga share it, etc. blah blah blah. Yeah. I don't want to stress myself. I want to have a stress-free environment, stress-free life. Kay lagas na mahalan na lang may stress it ibang nga tao haak nila ako say. That's my motto. May stress na lang kamo basta ako diri at may stress. Kay ano. So, yun. I have to come to school. So tomorrow 9 o'clock according to Misha. So I'm willing to wake up early tomorrow. So we will have the remaining. We'll have 2 chapters tomorrow and then another 2 chapters on Wednesday. So that after that, diba, Christmas break na kita. Okay? Okay, so so kung maray na kamo concerns na iba, thank you for your time. See you tomorrow at 9.
Thank you, Doc.
You're welcome.
Thank you, Doc.
Thank you, Doc.
Thank you po.
Thank you, Doc.
Christmas.
Thank you.